Dr. Adam Epskamp from West Coast Family Chiropractic. I'm going to talk a little bit about dry needling. Now, dry needling is a soft tissue therapy which typically targets trigger points within a muscle, or what we more commonly know as knots in the muscle, or those pressure points within the muscle. Now, the intent is to address myofascial syndromes, which means a pain syndrome that originates from within the muscle or the soft tissues around the muscle. Now, dry needling is really an offshoot of techniques developed by the pioneers in the trigger point field, Travell and Simmons, and there's multiple ways you can address trigger points, be it direct pressure or injection of substance into the trigger point, or another technique they call spraying. Now, what they did notice, while they had great success with all three of those techniques I mentioned, they noticed that they would get the same success without injecting substance, and so was born dry needling. Now, the needles that are used are those that you would expect to see with acupuncture, so it's a microfilament needle. But I should highlight here that acupuncture and dry needling are two very different therapies. But back to dry needling. Now, what would someone expect to experience during a session? Well, there's quite a spectrum of sensation, from the intermittent pinching that you might feel as the needle passes through the skin towards the target tissues. Once at the target tissues, you might feel a heavy pressure, or a reproduction of the pains you're experiencing, or you might experience a different sort of pain or a different pattern of pain. But like I said, there's quite a spectrum of sensations, and it's different for every individual. Now, the intent is to elicit what's called a local twitch response, and should we elicit that, that means that the success of the therapy is increased. So that's the intent, and the success and safety is fantastic. So it's very effective, and it can be administered by quite a spectrum of professions as well. You know, from chiropractors, physiotherapists, occupational therapists, and medical practitioners. And so, you know, with all those professions involved, it's a very safe technique. Like I said, very effective, and that's dry needling. So I'm Dr. Adam Epskamp from West Coast Family Chiropractic, and we'll speak again soon.